I got a few screws loose since the days of my youth. It's a few screws loose podcast.
I have no idea why doctors would prescribe Wellbutrin, because it made everything worse. And then the recovery period after you stop taking Wellbutrin. So the
washout. It's called the washout period, I think.
Damn, is that the term that's used for it?
Yeah, when you gotta, I think it's like 2 weeks. You gotta let it clear your body before you should start taking something else.
Man,
yeah, I remember that part. It's a long time.
Yeah, and so those increased symptoms last, well after you stop taking it. So after that, that's when my primary doc told me to go find somebody else, basically find a mental health. So that's how I ended up, mentioned Dr. Chester. Didn't work out for me. Went to Dr. Hung because I'm like, dude, okay, fuck all this psychiatric medicine. I need someone to put me back on Ambien. So he was like, and again, he specialized in sleep medicine. And around this time is when Ambien started getting a bad name, because you would hear reports of people doing weird shit, like getting up in the middle of the night, getting in their cars, going to drive somewhere, getting in accidents, not remembering anything. And what else? Like it's also addictive, but what isn't? I'll deal with addiction if I can get some sleep, because at this time I wasn't sleeping. I was like, I would go sometimes days without sleep. Then I would crash and burn, and crashing and burning meant maybe 2 hours of sleep for me. And again, this is also with having panic attacks while I'm laying there in bed, panic attacks throughout the day. And at that time, I don't want to use this term, but for lack of a better one, I became damn suicidal, because it's like, yo, I don't want to say I was suicidal. A better word to use is I toyed with the idea of suicide a lot, because I'm like, yo, if this is how my life is going to be, I don't want to live it. I don't want to not sleep. I don't want people, I'm seeking help. No one's giving me help. No one's giving me the help I need. My issues aren't being taken seriously. The doctors, and again, none of the doctors up to this point have actually listened to what I'm saying to them. They listen, and I work in IT. I'm guilty of the same thing. When people are trying to tell me what's wrong with their technology, I don't really listen, because one, let me figure out what's wrong with it. Two, I'll tune majority of what you're saying out, because in my experience, the people that I work with or work for don't know what the fuck they're talking about. Excuse me. They don't know what the fuck they're talking about. So I listen for key words and disregard the rest. Selective listening. So I felt like that's how my doctors that I was going to were treating me. It's like not listening to everything I'm saying. They're just listening for key things and running it against their mental Rolodex of how they treated this key thing last time that may have worked. Is that your experience as well?
Yeah, and I don't like that type of thought. In the fire department, we call that complacency, and it's dangerous in any. I'm not gonna say it's dangerous in any line of work. You go to Walmart and ask where the paper towels are, and they send you to stationery because all they listened to was paper. But I hate that, man. But especially in the medical field, it's a dangerous habit to get into. We were always trained, don't be complacent, listen to everything, because that one keyword that you may think you heard might have been someone saying, yeah, I thought it was this, but it wasn't. But you only hear that keyword and then you just go with that.
Mm-hmm.
So I feel as though my first psych that I had to go to, and another psychologist who I was forced to go to get me fired pretty much, they listened to what they wanted to listen to, and they filled in the blanks with what they wanted to fill the blanks in with. And that was because of an agenda that was obviously they had allegiance to my former employer to get me fired. But yeah, that happens a lot. And I'll just even go away from mental health for a second. Just when you have an injury, you get hurt or you go to the doctor for pain, they'll barely listen to anything you say. And instead of just understanding or realizing maybe this person has experience, they know what they're talking about. Maybe I shouldn't give this person an x-ray when they're telling me that they think they tore their ACL. They give you an x-ray anyway, and they say, oh, the x-ray doesn't show anything, you're fine, but your knee is swollen up like a balloon. So I would say, in my experience, even in the medical field from my former profession, that selective listening crap is common, man, and it needs to go.
100%. After that for me, Dr. Hung gave me, and P mentioned this medication earlier, I went in for Ambien. I went in for any type of sleep aid. This motherfucker gave me Seroquel to go to sleep. Like, and I'm pretty sure
that stuff is horrible.
Yeah, it's, yo, I'm like, what the fuck? And I mean, at the time I didn't know what Seroquel was, but I'm like, now that I do know, I go in here looking for a sleep aid, and this is what you give me. You give me a fucking rhinoceros tranquilizer? Like, yo. So I called him like the next day. Yo, I popped the Seroquel, went to bed, because you have no choice when you take Seroquel but to go to bed.
Zero.
I woke up 20 hours later. I was like 6 hours late for work. And how that look? I'm calling my damn supervisor and like, yeah, my bad, I took too much Seroquel. Like, you know what I'm saying? You don't want to share this type of shit with your employers, that you're taking all, like, and that's a strong psychiatric medication. It's for people with schizophrenia. So I said, dude, this shit don't work for me, man. I can't take this. I have to go to work. I got a job. I need to do shit. So his response was, well, this was his nurse, because I couldn't get him on the phone. And I'm pretty sure a lot of you out here can relate to this. You can't get your doctor on the phone. You get the front desk people who typically don't give a shit about you, don't give a shit about your treatment. They're just there. They're like, and I don't want to offend any people that work, in the front office of doctors' offices, but let's keep it real. Y'all just there to get a paycheck. It's y'all really couldn't give a shit about the damn patients. And I'm sure there are the exceptions. But so you get to them, and then you'll get a call back from a nurse. So then you relay your message to the nurse. Yo, this Seroquel knocked me out for 20-something hours. I can't take this anymore. Then the nurse says, okay, well, I'll talk to Dr. Hung and see what we can do. Okay, so now I've talked to two people. So the nurse calls back, and hours have gone by. Dr. Hung says, just take half next time. Bitch, why? So I could sleep half as long? Sleep 12 hours? Like, no, I'm not taking this shit. So,
well, I tell you what, I got Seroquel XR, which is extended release. And if you had Seroquel XR, I don't know if you did or not, breaking it open is actually worse. Because that's similar to how people used to break open OxyContin before they put the new coatings on it, where you would get all of that medicine release right then and there. Because I was on XR, and the dosage is double because it's extended release. And just like you, Dan, I was down for 20-something hours. And just a real quick, side note about Seroquel, the side effects are terrible. I mean, they've been known to cause diabetes. The average person on Seroquel, the average person who takes it regularly, gains 20 pounds. So it has a lot of side effects that aren't desirable. And I frankly believe, and I'm not a doctor. Once again, I'm not a doctor. I know a little bit about medication and pharmacology from my career. It's not always the best recommendation to just break pills in half. It's just not, because you ultimately don't really know how much you're getting in that pill.
Only pills I recommend breaking in half are the ones you're gonna fucking snort. Nah, but yeah, that's Seroquel.
Yeah.
That shit was terrible, man. So then I had to find another doctor. So I went into a sleep study program. And well, not a well, I guess you could call it a program. I did a sleep study because I'm like, all right, I know I'm not sleeping, but let me at least see if there's something that maybe a sleep study can pinpoint. Now, sleep studies are typically used for people with what do you call that shit? Sleep apnea. But went ahead along with it anyway, just to see. So the sleep study came back inconclusive as far as being able to pinpoint any reasons that I can't sleep. I did not have sleep apnea, right? So then it was like on the hunt again, found another doctor. At this point, I was placed on Zoloft. 50 milligrams of Zoloft, I think it was, a day. And Zoloft's an antidepressant, but when used in lower doses, supposedly it helps treat anxiety. Well, Zoloft made me aggressive, and by nature, I am not an aggressive person. I'm more stay to myself. I won't bother you. Don't bother me. Don't give me a reason to become aggressive. And I internalize a lot of the things that go on, even things that might make me angry. I'll still keep my mouth shut. Won't say anything until I get to a boiling point, of course, because it's like, and I'm sure P's the same way, is it's either keep my mouth closed or risk going to jail. Those are the only two options. So let me just keep my mouth closed. Well, Zoloft said, nah, nigga. You gonna run your mouth. So I caught...
Yeah, Zoloft will do that to you. Zoloft and Valium got me aggressive. That shit made me say and do strange things.
Damn.
And, you know, Dan, I don't know if this is the same with you. It's not even one of those situations where, like, look, I've never drank. I don't drink. I've never been drunk. But, you know, a lot of people say things when they're drunk and they don't remember all the time. Well, when you're on this medicine, when I was on Zoloft and Valium at the same time, I knew what I was saying. I planned on saying things, and I was happy to say it again. And I would laugh at, like, man, this shit makes me unhinged. It takes away inhibitions, and man, Dan, that sure is true, man. That stuff will have you looking at somebody that you've been smiling at and saying hi to every day at the grocery store and saying, fuck you, man, just to see what they do.
Hey, fuck you. What you gonna do?
Have a nice day, nigga.
Man, yeah. And speaking of the grocery store, actually, that's where I had one of the first incidents as far as being on Zoloft. The lady double scanned something. People make mistakes. I have a problem with people making mistakes sometimes, a lot of times when it's a mistake that shouldn't have been made, but people make mistakes. She double scanned something on the cash register. So beep, beep. And when I saw that, I'm like, yo, you scanned that shit twice. And she was like, I know, I'm going to take care of it. And I'm like, nah, man, there's no fucking excuse to scan the same thing. This is your job. Your job is to scan shit one at a time. Why the fuck would you scan something twice? You know what? Your ass needs some training. And see, this was wrong with y'all motherfuckers that work here. Y'all don't give a shit about y'all job. And I'm like going in on her. And that's not me. Like, that's not me. Normally, that's something I would laugh at and be like, yeah, man, I be fucking up too sometimes. So anyway, I'm like, that was very unusual. And I was unusually hostile and aggressive. And I'm like, at the time I didn't put two and two together. I'm just like, yo, I'm mentally breaking down. Yo, something's wrong. Something's really wrong with me. Then it got to the point where, and I was on the phone with P this time. I'm sitting at an intersection waiting to turn onto Veterans Highway. It's a 3-lane highway. I needed to get in the far left lane. So turning on red, I couldn't just turn into the right lane because it was like an immediate turn I needed to make. So the person behind me just starts beeping. Beep, beep. And I'm looking in my rear view mirror and I'm telling P, I'm like, this stupid motherfucker behind me. So there was a cop beside me. The cop gets on a bullhorn and goes, "Excuse me, sir. You can turn right on red." Police. So I rolled my window down, stuck my head and half my body out the window and started pointing at the cop like in his face, like, "No shit, motherfucker." And like I start going in on this cop. And then I like go ahead and I make the turn when the light turns green. Like I told the cop, "Fuck you, I ain't turning." So P says, "Damn, what was that? Like a loudspeaker or something?" I was like, "Yeah, those police." Like, "Damn, nigga, you just cuss out the police?" "Yeah, man, fuck that like it was regular. Yeah, fuck that motherfucker, man."
I was like, man, y'all be tripping down there, man. Yeah, like, this motherfucker just cussed out the police.
Yep.
Like, damn, you understand? I know I heard the South was different, but damn.
Yeah, that's real different, man. So yeah, that Zoloft shit. After that, I kind of started, and a few more outbursts, none that were as memorable. So I'm like, yo, this Zoloft shit is not for me. And again, tell my doctor, and what do? They prescribe you something else. So at that point,
were you on Zoloft when you beat up the people at Walmart? Didn't you beat the people up at the Walmart that time?
Yeah. Nah, I wasn't on nothing then, man. That was before
his hammer went into a berserker rage,
man. Huh? And I was mad because I had a leather jacket on too, man. You ever try punching someone in the face with a leather jacket on?
I ain't never had a leather jacket.
Man, I thought I was motherfucking Tom Cruise or some shit. Top Gun, motherfucker. Man.
Motherfucker walked around looking like wasn't that Tom Cruise in Top Gun? What was that nigga? What was his name in Top Gun?
Shit, I forgot, man. It's been years since I seen that shit. But yeah, man. So
Top Gun.
After that, I completely gave up. I stopped seeking help after that. It's like the medication wasn't working, and at that point, it was like if no one can help me, I'm just gonna have to figure this shit out on my own. So Pete, now where we at with you as far as okay, your Valium, your Valium and your Zoloft was your magical combination. Is it safe to say that you've been on Valium and Zoloft ever since?
No, it's not. I haven't been on medication in about a year now. I used to get my Valium and Zoloft from my general practice doctor last year. I don't have a psychologist anymore. I do see my doctors when I go back to Virginia, just, every so often, because I still have issues, but it's just not been as easy to get the medications here. Now I've, figured things out a little bit where I can kind of get by, but as a regular thing, I stopped taking the Zoloft before the Valium because after a while, the Zoloft just started making me feel sick. Even if I was taking Valium, it just made me feel like I had the flu all the time. And one doctor told me that what can happen is you can get a serotonin buildup in your stomach, in your gut, and that can make you have stomach pains, stomach cramps, and things like that. So I just kind of I went back to just taking the Valium as needed. As my primary source of medication, and that is done fairly well. The bad thing about Valium, though, is you can't take it for extended periods or else you get a tolerance and it stops working. So that's kind of where I was at. I had to slow down to get myself back to kind of squared away to reduce my tolerance again, or else I'd just be taking it for no reason.
So during that time, how did you manage?
Well, there was a time when I flooded the bathroom because I'll say the last time I took some Valium, I fell asleep in the tub with the tub running, and the floor was wet, and I flooded the bathroom, and my wife looked at me and said, "Hey man, you flooded the bathroom." So I opened my eyes and looked at her, and I was like, "What? Damn, the goddamn toilet broke, man! The fucking goddamn toilet broke." And I looked at the tub, and the water was like at my neck. I said, "Huh, that wasn't a toilet, that was a tub." So that was probably my last time taking Valium, and that wasn't because I'd taken too much or anything. That was just when you take it for extended periods, you're supposed to lay off. Mm-hmm. It's not designed for long-term use, and sometimes you can have these strange situations because it'll kind of build up in you a little bit, especially if you have to take it a couple times a day. And that was in a particularly anxiety ridden period when I had to take a couple doses a day.
Right.
So that was the last time I took it, and that was a good while back now.
So with
to me, it's still my go-to. It's still my most effective and most reliable medication that I've taken since I've been on this I call it my stupid problem, this stupid journey that I've been on.
Well,